And February is American Heart Month. We want to talk about heart health screenings and everything that you need to know surrounding the good old heart. Joining me now is Dr. Natasha Mamdani with Wellstar, a cardiologist, an expert in all things of the heart. So, Dr. Mamdani, thank you so much for being here with us today on this very important topic.
Thank you so much for having me.
I want to just start by getting into what you are seeing from your patients here locally this time of year.
Well, this time of the year is notorious for all sorts of viruses. All your flu viruses, COVID, your uh, run-of-the-mill cold virus that can precipitate heart failure. So we do see that quite a bit. Pneumonia, things that can also trigger arrhythmias like atrial fibrillation. Cold weather also tends to constrict blood vessels. So heart disease and heart attack tends to be more common around this time of the year. So definitely seeing a lot more of that in the hospital.
Yeah, certainly. And when things like that happen, you have moments to react. So it's always good for the more you know about this stuff and the more you can look out for the signs. What are some of the common signs that families and even people with heart complications should be monitoring?
Yeah, so, of course, we all know about the typical chest pain symptoms that we see on the TV, or, sometimes happens in front of you, where you see an older man having chest pain, kind of, holding onto his chest, clenching onto it, has difficulty breathing, sweating, those kind of things. So, that's what everyone associates with a heart attack, right? What we don't know, and especially in more common in women, is that some symptoms are a little bit more vague. So it could be heartburn sensation, it could be shoulder pain, jaw pain, especially on the left side. Sometimes you have radiation down the left arm, fatigue, unusual fatigue. So, say you're able to do things easily before, like climb a flight of stairs, or keep up with the kids, go out for a walk, whatever it may be, and now you're kind of having difficulty keeping up with that. You're getting tired easily, you're getting short of breath, or having just vague sensations in the chest that weren't there before. So these are common things to kind of look out for that go unseen. Sometimes also nausea, especially in women, and shortness of breath are big things.
Yeah, certainly. And I'm glad you bring up the difference between men and women because it's important to talk about any particular age groups and vulnerable populations.
Unfortunately, heart disease can happen to anyone. It is really a disease of childhood. We start seeing beginnings of heart disease, if it's not already, genetic and congenital, around the age of 10. So it really kind of spans across decades for everyone.
And, we talk about it really being not something that necessarily happens in old age, it can happen at any time.
Yeah.
Anything that folks can do to take preventative steps?
Absolutely. So, the biggest things are going to see your doctor. It's so important to know your numbers to mitigate the risk. Prevention is always better than cure. So know your blood pressure, know your blood sugar levels, your cholesterol numbers, how active you are. A lot of us, especially in today's day and age with AI and remote working and things like that, we're a lot more sedentary than our parents' generations or their parents' generations used to be, right? So being more aware of how much time you're spending just sitting in a chair, right? So even little things like getting up and going around and walking around, or whatever you can do just to stay active and keep your body moving, can go a long way. There's a lot of advances in medicine. Of course, there's advanced testings that can be done, but it is recommended to start screening at the age of about 11 to 12 in kids, for cholesterol, blood pressure, all of those things. So really start then. But if you have not yet started, now is a good time to go to see a primary care physician, have everything checked, your labs, your blood pressure, everything, your weight, and then based on all the information together, your physician can formulate a plan that is tailored to you. And then if you need to see a cardiologist from there, we're more than happy to see you and help you through this path.
And the tech really has improved and is the best it can be at this point. We talk about seeing the doctor, and that can be a little daunting, but it goes a long way with not only preventing significant heart complications, but also addressing some of existing ones. What is the typical process like when a patient comes to see you? What kind of technology do you all utilize? Can you get into that a little bit?
Yeah, absolutely. So it really varies, the reason a patient's coming to see me, because, really see all sorts of heart diseases. So, coronary artery diseases being the biggest thing that we see, but there's also congestive heart failure, cardiomyopathies, preeclampsia, peripartum cardiomyopathy, all sorts of things. So let's just take the coronary disease, the heart disease that everyone thinks of when they hear the term heart disease, right? So if someone's coming to me with symptoms of chest pain that is concerning for a potential blockage in their heart, coronary artery disease, the first and foremost, is the EKG, right? So the EKG tells us what your heart rhythm is, if there has been an old heart attack, if there's ischemia. So ischemia is ongoing reduction in the blood flow or ongoing heart attack that you may be having. And then tells us about your heart rate, rhythm, all of that. After that, we have a conversation with the patients to kind of try to understand what their background is, what their risk factors are, what their lifestyle entails. And then after we have all of that information, if they have not already seen a primary care physicians and had some of the blood work done, we will order the complete blood count, kidney function, liver function, hemoglobin A1C, which checks for diabetes, cholesterol panel. And within the cholesterol panel, there's also some advanced testing that can be done to kind of really look for your risk of heart disease. So those would be things like high sensitivity CRP, apolipoprotein B, lipoprotein A. So these factors, these markers significantly increase your risk of heart disease, and some of it has genetic component to it. And then, of course, blood pressure check is very important, checking your weight and BMI at every visit. And then once we have all that data together, we then order an exercise stress test or a test of some sort, depending on the patient, obviously, right? So again, everything is tailored to each individual patient. If a patient cannot walk on the treadmill, is wheelchair bound, obviously, there's not going to be an exercise stress test for them. We'll do another modality. So there's chemical stress tests we can do. There's coronary CTA, which is a big deal right now because the coronary CTA is a CAT scan of your heart where we inject a dye, which is an iodine-based contrast, and that goes through your heart arteries and gives us a very, very detailed picture of your heart arteries. So it shows us exactly how the blood is flowing, exactly how much plaque you have, what kind of plaque you have. Is this a soft plaque, hard plaque? And I'll explain what the soft and hard plaque are in a minute. Um, it tells us if there is plaque, how much blockage is it causing, how much of the blood flow reduction there is. And because it is a CAT scan of the chest, also kind of helps us see a little bit more than just the arteries themselves. It shows us the aorta, which is the big artery that comes out of the heart. So the size of the aorta, whether there's plaque in the aorta itself, the pulmonary artery, which is the lung artery, if that is dilated, because then that would point towards elevated pressures in the lungs. It also shows us a little bit of the lung fields as well. So if there's nodules or any abnormalities, it will show us that as well. So coming back to the soft versus the hard plaque, before I forget and move on to something else. So when the plaque first forms in the heart arteries, or any arteries for that matter, it's a soft and mushy plaque. That's the plaque that is prone to rupturing and causing a major heart attack. So your body doesn't like that. So it has a way to kind of stabilize it. And this is an example I pretty much give to all my patients, and I'm going to go ahead and say it here as well. So when you have plaque, right? And so think of you driving on the highway. and you get into a little bit of an accident, and every time there's an accident on the highway, the bystanders will be there, right? People slow down, people stop to see what happened, try to help out. And that can cause a traffic jam, right? So same thing happens with the heart. When there is a plaque there, all sorts of things will, the components from your blood will kind of come and try to help it out, trying to stabilize it, things like that. And that can cause the blockage to get worse sometimes, especially if this is a heart attack, right? Because that causes the injury needs to get fixed, everything's coming, trying to patch it up, things like that, and in the process it's just closing up the whole artery. That's a major heart attack. Your body does not like that. So what it does is, okay, well, it sees there's a little accident there. Let's move the car to the side. Let's block it off with some cones and just get a few people to come and help out here. Let the rest of the traffic keep flowing. And that is what the hardening of the plaque is. So that's the calcification process. So that's the heart plaque that we see. Not that any plaque is good, but the hardened plaque is a more stable plaque, and less likely to rupture and cause a major, major heart attack or cardiac arrest.
Yes, no one wants that. They want to make sure to get
No.
ahead as best as they can. I did want to kind of address the folks that aren't able to see a doctor. Maybe they don't have insurance, and just those low income communities, they can't access this quality care. What are things that they can do at home to monitor each other, themselves, and just make sure that they're doing the best they can to protect their heart?
So a lot of pharmacies, CVS, Walmart, Target, they have blood pressure monitors that are just out there for anyone to use. So if they can't afford a blood pressure monitor or can't afford to go see a physician, they can definitely, go and use those resources there where they can go check their blood pressure, keep an eye on their blood pressure. And if they start noticing that it's high, then there is I know some of the hospitals have charity clinics, or clinics for low income population who are unable to reach physicians or have insurance to pay for things. So they can definitely reach out to them to have further care from there. Because once you know you have high blood pressure, you do want to get that taken care of. Other things they can do at home is, of course, making sure that they're eating healthy, right? That can easily happen in the kitchen. Just try to avoid fattening foods, fried foods, making sure you're not eating processed foods. Read the labels. When you're buying in the grocery stores or making things at home using different ingredients, read the label. I cannot emphasize enough how important that is. You want to make sure that you're looking at the sodium content. Your total sodium content for the day intake for the day should be less than about 2 grams or 2,000 milligrams. And it's so easy to go over that. I mean, there's a lot of times when I've noticed myself going way, way, way over, and I don't even realize it until I'm like, oh my God, I just read the label, and maybe I should have done that before I ate something, right? Or made or used that particular ingredient in my cooking. And then looking at the cholesterol level in the foods, making sure you're eating more whole foods. So fruits, vegetables, whole grains. Try to avoid processed foods, like I said. Red meats are not good for you. Bacon is probably the worst meat for you, unfortunately. And I know a lot of people tend to really like bacon. Chicken, lean meats, fish are really good for you. So you could definitely do that. Simple things you can do at home to stay active would be, if you work from home, try to take breaks as much as you can, even if it's 5 minutes every hour. Just go outside of your office, your home office, or wherever you are. Go take a walk, come right back, right? Even if it's just to go get water. Or if the weather's good outside, and of course today's is not such a good day here in Atlanta, it's raining. But if the weather's good, go take a walk. It's the nature is amazing, and you can get some vitamin D and some happy sunlight and everything to just boost your mood. Sleeping is so important. Making sure you're sleeping at least 7 to 8 hours at night. You'd be so surprised how many patients I see who tell me they're sleeping about 4 to 5 hours a night. And it's for various reasons that they're not getting the proper sleep. Majority of the time, it's that they're spending too much time on their cell phone, or they have a TV that they're watching while in bed. And, of course, we all know when we're watching a Netflix show or anything on the TV and we get so absorbed in it that we're just like, oh, I want to know what happens next. Let me just keep going. So try to not watch TV or do anything on a screen when you go to bed. Bed should just be for sleeping, not for watching TV or doing other things. Making sure you have a proper sleep hygiene. So whatever that may be for you, whether that's making sure you brush your teeth and wash your face before you go to bed, so your mind's getting ready for that. I personally sleep with a white noise, so that gets my mind into thinking, okay, well, white noise is on. This is my sleeping time, and my body just gets ready for that. So, there's a number of things you can try to help you with that. Um, what else can we do at home? Let's see. Try to talk to people, right? A lot of times we feel down and depressed, and our first go-to thing is food. A lot of times, right? And so instead of that, pick up the phone, call your significant other, friend, whoever may be available at that time, and just let it out. You don't have to hold everything in. You don't have to be a superhuman. We all have things going on in our lives, and we just all need to find ways to vent it and process it and move on. Because the more you hold on to it, the worse things get, and stress adds on to heart disease.
Yeah, stress is definitely one of those. And all of those tips, I just want to say, are good for other parts of your body and yourself as a whole. So it doesn't hurt
Absolutely.
to just try it and see what happens. Dr. Natasha Mamdani with Wellstar, thank you so much for coming on here for American Heart Month. A really important conversation. And if you haven't gotten tested recently, or you are looking into more information on getting to know your heart health better, you can connect with Wellstar. Dr. Mamdani, I just want to make sure that if folks wanted to reach you, they had an opportunity. What is the best way to go about that?
So I work at the Wellstar North Fulton office and the Wellstar Avalon Health Park. You could just Google, find the number, and schedule an appointment. So we're usually pretty good about getting our new patients in. We try to get them in within 1 week for the most part. And if for any reason anyone has any trouble to get in, feel free to leave a message with my office and let them know that Dr. Mamdani said that she will see us, she will squeeze us in. I will be more than happy to get you in as soon as I can.
Especially during February, the most important month to
Absolutely.
talk about the heart. Dr. Mamdani, thank you so much again. And to all of you watching, we will have a full link to Wellstar and more information about heart disease and heart health on our website, atlantanewsfirst.com.